Next up, we have Dr. Brandy Schillace. She's a historian of medicine and the critically acclaimed author of Death Summer's Coat, Clockwork Futures, and most recently, Mr. Humble and Dr. Butcher, described as the New York Times as a macabre delight. Her books have been reviewed in Science Magazine, the New York Times, the Boston Globe's, New Yorker, and many more publications. She's the host of the Peculiar Book Club, a live stream community of authors and readers, and has appeared on the Travel Channel's Mysteries at the Museum, appears Here and Now, and Fox's American Build. She is the 2018 winner of the Author Peace Sloan Foundation Award. In addition to her work as an author, she's also the co-editor-in-chief of BMJ Medical Humanities Journal, and that is what brings her to us today to enlighten us with her knowledge. I'm so thrilled to turn over to Dr. Schillace.
Hello, hi everybody. My apologies. I was eating toast, so I will try not to be toasty in my presentation. I'm really excited to be here, and I think basically I want to talk a little bit about what BMJ Medical Humanities is and does, and what makes it slightly different than other journals that I think are out there. And some of what makes us different is that we have a real focus on global health and also social justice, which is I think perfect for medical humanities, really. So I'm going to attempt to show you my presentation here, and we'll see if I can make this work correctly. Chizomo, you might have to rescue me. I'm assuming I need to share my screen.
If you don't, just send an email to me and I'll do it.
Yeah, we'll see if we can make it happen.
You should accept the co-host thing now, so it should happen. Yep, you're sharing your screen.
I'm sharing my screen. Fantastic. So I wanted to start off by talking a little bit about, and the title of this is A New Way of Seeing, and I really meant that when I took over the journal for medical humanities. I really wanted to have a different perspective, and medical humanities can be treated in a lot of different ways. One of the ways that it sometimes is talked about is it's very much beholden to medicine. And so you'll see certain medical humanities groups or journals or other programs which seem to privilege the medical viewpoint or the medical gaze. And we didn't want to do that. We wanted to privilege a humanities perspective. We wanted this to be a conversation among and between and with, not about and at. So that's one big difference, I think, about our look at things. So I say medicine has a human problem. And what I mean about that is medicine is supposed to be human-centered. And if you're not human-centered, then you're doing it wrong, right? Because basically, if you are not treating the human being, and a human is a complex person, a complex individual, you're not just systems and digestive, digestive systems and lungs and hearts. You're an entire person who lives in a community and has a culture that surrounds you. So one of the things that we noticed is that the medical humanities has been treated really differently. And I always like to give a bit of a history. And of course, many of you already know this, but if you start back in time, medicine was already a very humanities-based thing. And so I love this woodcut. It's from 1509, and someone's got a book and they're feeding them, and there's a priest and someone's testing the urine, which they did by taste, which is not advisable. But they did all of these things, and that was medicine. You were completely surrounded by a community of different perspectives. And early medical care was sort of a marriage of all of these different things, including history and philosophy and cookery and all sorts of things. You spring forward a little bit, and even early anatomy, you still have that sense of the whole person. I love this. I call this the Cabbage Patch anatomy, right? So it's supposed to be showing you an infant in utero, but she's looking good too. Mom's looking good. She's got good hair going on, and she's got a little Cabbage Patch baby there. And it's beautiful and it's lovely, and you're seeing all of the person and where she lives, and all this is related. But compare that to the way anatomy becomes in the 18th century. And on one hand, it's much more accurate. Now what we're seeing is piecemeal, right? You no longer see the woman's body. You basically just have a part of the body, and you're looking at the pathology. And that's good in many ways, but it's also a move away from seeing the whole picture of a human patient. And I used to work in a medical museum, so forgive me for all the history stuff. Indulge me. But essentially, doctors used to focus on everything. They would deliver babies and fix your eye and, listen to your lungs. And general practitioner really meant that. And now we're far more specific in what we do. And that's good in the sense that it's helped medicine progress and we've learned all of these things. It's bad in the sense that now we went from seeing a whole person to seeing these to seeing molecules almost. And we feel that medical humanities is a course corrective for that it's a new way of seeing across disciplines that's in search of social justice and that is really interested in accessibility and access to, and that means everything from minority groups to global health to disability services, but that we need to be looking at this in a really broad way, and that it's a way of supporting the human at the center. So I'm going to skip over that, but here we go, getting back to the global stuff. The global and critical health humanities, I always feel like I have to define that for people, because what we mean by global, too often it means, those nations we personally collaborate with, right? Or those nations who are most unlike us. You get one or the other, right? People say, oh, this is an international journal. And then you find out that it just publishes people from the United States and the United Kingdom. Well, it's not exactly international. I mean, it is across, it's ocean, you're across the ocean, but you haven't really done something global. The other is sometimes people use global as a way of like looking at kind of othering, looking at something and going, oh, we're going to talk about them. Yeah, we're very global. And that's not what we mean. What we mean is constructive communication. So I say this a lot in our videos. I don't want to hear you talk about somebody. I want to hear you talk with somebody, and I want those communities to talk back. And so this is to make it a real dialogue means having to reach beyond and getting a chance to hear from people that we don't normally hear from, and not doing it as a way of like, oh, we're going to be nice and listen to these other voices, but instead recognizing that they are colleagues with a lot to share and a lot to teach us. And so it's a collaboration, and that can be tricky to do, actually. And I'll get into that in a minute. But what we mean by critical medical and health humanities is essentially it's offering a perspective from humanities disciplines. It looks back at medicine and systems of public health, and it critically examines why these systems do or often do not work and how they serve or inhibit justice. And so that's very different from a kind of like, we're going to do medicine and also read some books. It's not that. This is a getting underneath it and getting your hands dirty, and upsetting people sometimes. I mean, we publish things that rile people occasionally, because sometimes people need to be riled. There are things that are problematic that need to be addressed. This is just an overview of kind of our three parts. Medical humanities is not just a journal. It is a journal, yes. We do high quality research and all that stuff. 60-40 split between humanities and medical or clinical stuff. The blog is really important, and it is not some throwaway extra piece. We use it as a medical, almost like a medical magazine, a different kind of publication that reaches a slightly different audience. It's free, for one thing. It's not behind a paywall, and it's where we do our it's not grooming, but it kind of is. So basically, I told you, we want to hear from people that we've never heard from before. We want to hear from people from countries in Africa, countries in parts of Asia, places we've not actually interacted with before, and have them tell us what they're doing in terms of medical humanities and social justice. But for a lot of those people, English is not a first language. And of course, one of the problems of running a British medical journal is that all the papers have to be in English, and they're competing with people for whom English is a native language and who already know the ins and outs of publishing in a British journal. So what we've done is we've created space using the blog as a way, if you want to test yourself out, because I can't offer extra editing to journals, to articles that come into the journal, because that wouldn't be fair to everybody. But on the blog, which is our free component, is more magazine-like, that's where we do a lot of editing. I have myself and a content editor, and we work back and forth with authors, kind of help them hone and sort of re-see what it is that they're trying to communicate. And that's really great for early career scholars or students. It makes a great global platform for people who are struggling to figure out how to put their words in a way that makes sense in a British medical journal. I don't know how else to put it. It frustrates me because so much of how we decide whether or not something is is acceptable in a journal is already dictated by sort of white, Western, often masculine, cis-het norms. And so it does make it very difficult and frustrating, because you want to hear them, and yet you're not really allowing people to speak with their own voice. And to the extent that I feel like we end up only publishing pieces that ape the colonizer, I guess, that are basically like, oh, I've learned how to talk like I'm a British person. And I'm not British, by the way. I'm American, and I don't fit in either. I get asked a lot if all Americans are like this, or if it's just me. It's probably just me. But I think that for us, what's important about that is we can't fix it exactly, but we can recognize it, and we can call it out and say, okay, this is a problem. So the blog is one way that we've figured out ways and places to fix it. The other is special issues, because a special issue has a mediator. You have got special issue guest editors, and they often bring the papers in to conferences or to online conferences. They vet them, they work together, and there's a lot of work that can go on there before we ever get them. And then that's another way of like helping people bridge that gap so that their work competes just as well with everyone else, and therefore can get accepted when we send it out for peer review. The other issue is expanding our peer reviews. And so one of the things that we do is we have the authors of the papers recommend reviewers, and we often pick from that pool. And the more you recommend, the better off we are, because then we can go down the list. And that means it's not just us. We don't have like, here's our group of people who review our papers. We have as many reviewers as we have paper submissions. So that's because we're trying to pull in reviewers who are also not the standard white, Western, normative, people, but who are nonetheless well-respected peers in the field that we're talking about. So that's another way we do it. The third thing we have is the podcast. And the podcast, that's our edgy, most public-facing thing. And that's where we do a lot more of the sort of political stuff. We bring on disability rights activists like Alice Wong. We've brought on political people. We had one of the first openly gay senators, state senators came on to talk to us. So this is the place that we do that work. And it's also a nice place for someone who, I don't know about you, I can communicate in another language, sort of. Okay, so French is my other language. I can communicate much better if I'm talking to you than if I sit down to try to write something. It's not going to come out as professional. It's not going to come out professionally the way my writing in English does. So the other thing we recognize is a podcast is a place where somebody who might be better at speaking than they are at writing in a scholarly English way can come on and talk to us and share their viewpoints. And that's also free to the public. So our journal is probably the most limiting place where things get published. Then the blog, and then the podcast. And of course, with Plan S, a lot of things are going to be open to the public. But once again, a journal is still an academic audience, and that's a much smaller one than what we're able to reach a much wider audience with these three areas. Some challenges, obviously, we still have the white old West standards and review, but we want to hear from and speak with, and that means starting conversations and combining perspectives. And we did the December special issue way back. This was for mostly South Africa, but we also, I think Nigeria was also part of that too. Chizomo, you'll have to remind me because I forget a little bit. We've done some other ones. These obviously we're trying to engage with things that are happening right now, and being honest about the limitations that we have. Here's our SoundCloud, so you can see some of the people who have been on there. It's been an absolute joy, because I feel like that's our most creative space. So I think that this is a way for us to really move forward. It's a surprising, I was surprised to find out no other journals were doing this. This is actually quite niche, apparently. So this is what we do here. We're the only medical humanities journal, and maybe one of the few journals for the BMJ period, who are doing things in this way. And it's exciting for us. And we're, I'm not going to play that video. That's when I had more hair, by the way. So that's basically where we are and what we've been trying to do over the last couple of years. And I'll be entering I think this is my 4th year I'm entering into, and I've got a 5th year, and then contracts are up for renewal. But it's been exciting. And we also recently added Chizomo to our editorial board. So she's also on the editorial board of our journal, along with a lot of other people, including openly LGBT people and several disabled scholars as well. and some people who are not scholars. In fact, one of our associate editors was a nurse practitioner who now works in administration, and we think that's really important. So I'm not actually in academia myself. I absconded from academia. I should probably admit that. Like I left, I snuck out. And I'm a freelance writer and I do the editing for the journal, but I'm actually no longer attached to a university, which has certain freedoms, because once in publishing an article that was that upset someone, they called back to me, they contacted me and said they were going to speak to my chair. And I was like, this is the only chair I have. So it does give you some freedoms, and I'm open to questions. I'm happy to field any questions and answer anything for you, or just in general chat up and get to know you.
Thank you so much, Brandy. I want to jump straight to questions and give a few minutes for that. And then we can go to the writing workshop immediately after, and I'll start that link. So does anyone have any questions? I've put the link in the blog. That's what Helen has asked. And
hi there. I actually found out about this whole conference through your Twitter.
Oh, hooray!
So yeah, I'm happy you managed to get to see you speak. I'm Atka. I'm currently a medical student in the UK, and I just had a question regarding this kind of student outreach that you have not only within medical schools but in humanities subjects as well.
Mm-hmm. Well, it's basically we just encourage, we mostly encourage that at the blog level. We also will totally accept student papers. However, we do not mark them as student papers. And at first I got a little bit of blowback from that. They said, well, shouldn't you have a student paper category? I was like, no, if they can write something that's good enough to go in the journal, there's no reason for us to call them out as students. They're colleagues. So we don't have a student component, but we have published student papers at times. It has happened. We like the blog for that, partly because, like I said, it gives us a chance to connect with them and do some editing. But it's also a place, the blog is a little bit, it's not that it's less academic, because we still require the blog posts to have academic components in them, but they can also be places where you are, you're dealing with things. You might be a little bit more personal narrative like in it. You could say like, look, this is what I saw as a student. And so it's got a research component, and it can have a little bit more of a, I'm trying to grapple with these issues. We almost, you might think about it the way you might go to a writing workshop or something, or to a conference. It still has to have that academic flavor to it, but it can be much more about, you know, the ideas that you're trying to grapple with, and people can access it. They can comment on it. You can reach other writers. It's also immediate, because our journal, unfortunately, it's a good thing and a bad thing, is we have so many submissions. We didn't, but once we changed everything, we ended up being inundated. We have so many submissions that we have a backlog. And as a result, if you get accepted today, you might not appear for a year or more. Whereas if on the blog, I mean, well, you'll go online sooner than that, but I mean, in a print journal, you might not appear for a while. Whereas if you write to us in the blog, you send it to me, I send it to the content editor. I mean, it could go up in a week. So if you're talking about something really immediate, I also think that the blog is a good place for that.
Yeah, that's really cool, because I'm involved with the Medical Humanities Society at my uni as well. And I've had questions from people asking about how publishing and stuff works, because as you said, it is quite niche. So I'll definitely pass it on.
Yeah, please do. Please do.
Yeah, thank you.
thank you so much. I think we're just going to keep going for another couple minutes in case anyone has questions for all three of the last speakers. So that's Sneh, Nusa, and Brandy. If there's any remaining questions, we'll just take them, and then if not, we'll close up, and we have to close up and put a link to the writing workshop next.
I like questions. I mean,
I thought this was just so incredibly thorough, but I'm just going to wait a little bit longer to see. I see. So no more questions.
No more questions. Don't you want to know what my favorite color is?
What is your favorite color?
Black. It's all the colors.
Okay. All right. Well, I think we're I forget it's 10 o'clock where you are, and we're pushing 5 in South Africa and 3:30 here. So I think we're just going to close up with a writing workshop. But I just want to thank Brandy for coming. That was absolutely wonderful, and thank you for telling us. I know that everybody has been asking about where do we take this next. So that was a really critical piece for us. So we're really grateful that you were able to.
I just want to say I'm really excited about what you're doing. I get frustrated. I feel like medical humanities in the United States, which is where I'm based, tends to be unfortunately swallowed up a lot by medicine or by narrative medicine, which is also not what we do. I'm a little suspicious of narrative medicine because of its privileging of which voices it privileges. I think can be a problem. But I feel like, you know, we need these new spaces, and I feel like it's being done more organically in other places, and there's so much that the UK and the US could learn from how things are being done elsewhere. So I'm excited, and I hope that I'll see submissions from people.
Thank you. Thandeka, you have
Thandeka is okay. No, I wanted to say Thandeka is in hand.
Let me unmute her. I think Thandeka was dropped off. I don't see her.
Oh,
Oh no, she's there.
She's here.
Yes, I'm here.
Okay.
Hi, everybody. So thank you so much for these awesome presentations. I think they're very thought-provoking, and I really think it really pushes us to think carefully and deeper in terms of what we do going forward. And, you know, given new dynamics like your COVID-19, I think the presentation about the qualitative research and really important questions we need to ask with lockdowns and all of that, how do we, you know, plan to engage with our interlocutors in this process? I think they're a very important question to ask. But I just have a quick question in terms of the last presentation by Brandy. I'm really excited to note that, you know, there are spaces that are not so academic in terms of, you know, early researchers and other people that don't really have the confidence maybe to write papers and all of that. But there's actually a platform for people to actually voice out some issues that they feel very strongly about. I mean, like, for instance, I think that I've been called out a lot of times and being told, you know, like where my place is, or you can't say this kind of thing because, you know, the scholarship that is supporting you cannot support these kind of things or this kind of a narrative. So I think it's really good to know that there is some emerging journals that are really open to these kind of things where we could feel safe to voice them out. And as we grow up in our career, because so far, you know, the authoritative voice would be, you know, you are a senior scholar or you're so advanced in your career, and therefore that's when you have authority. So if I'm fresh and new and vibrant and I've been exposed to this thesis or this work I'm doing, and I really find thought-provoking questions and questions that are not normal for people to ask, then I just feel like, you know, helpless because I cannot put it down. Even if I put it down, maybe it's just for my journal because I'm venting out. So I think this is really good. We need more of such kind of spaces. If we really have to make a difference as medical health humanities, I think we need such kind of forums, because these kind of submissions can be looked at and be polished and be presented and be pushed into platforms where, you know, maybe there'll be more audience or people that are willing to hear that kind of narrative. So just a big up for that. Thank you so much for giving me time.
Thank you. And I am the point of contact for almost all this stuff. So you can reach me. I have a website, but you can also reach me on Twitter. And I think that when you go to the blog submission page, I believe that when you submit, it actually just comes directly to me anyway. So it's I'm actually surprisingly easy to reach. There's not a lot of levels. We actually tried to create it to look like there's levels so that I don't get inundated, but it really, like, it's me. It's just me.
I've just dropped your Twitter handle in the thing, and I'm just going to put your website as well. And then I
fair warning, I'm not an academic on my website, just so you know. That's my author website. So please check it out. It's a lot of fun. But yeah,
well, it has a contact link on the last page, and also your work is fabulous, and you should be reading it anyway. So that's yeah. So anyway, thank you so much, Brandy, Nusa, and Snea. We're just so happy that we were able to get you in. All of you, it's been amazing. And I'm going to close this page and open up the new last page for today's writing workshop and turn over to Nowazi and Carla. So we'll see everybody who's coming from the workshop in a minute. Thank you, Brandy, and everybody.
Thank you. Bye-bye. Thank you for having me. Bye.